What pollen count is dangerous for child allergies? Imagine a day when your child starts sneezing more than usual, their eyes itch, and they just don't feel like playing outside. You might wonder if the pollen in the air is to blame. Pollen count is a way to measure how much pollen is floating around in the air at a certain time. It tells us how many pollen grains are in a cubic meter of air, which helps us understand the risk of allergy symptoms. But there is no single number that is dangerous for every child because each child's allergy sensitivity is different. Some children might feel fine even when pollen levels are high, while others can have symptoms at lower levels. Generally, pollen counts are grouped into categories like low, moderate, high, and very high. When the count is low, usually between 0 and 30 grains per cubic meter, most children with allergies won't have symptoms. As the count moves into the moderate range, between 30 and 50 grains per cubic meter, some children might start to notice mild symptoms like sneezing or a runny nose. When the pollen count reaches high levels, between 50 and 100 grains per cubic meter, children who are sensitive to pollen often experience more noticeable symptoms such as itchy eyes, congestion, or coughing. If the count climbs above 100 grains per cubic meter, it is considered very high, and children with allergic rhinitis or pollen-triggered asthma are more likely to have significant reactions. These symptoms can include severe sneezing, difficulty breathing, or worsening asthma symptoms. It's important to remember that the type of pollen also matters. Tree pollen, grass pollen, and weed pollen each have different seasons and levels of allergenicity. Children who are sensitive to certain types of pollen might react more strongly during specific times of the year. To help manage allergies, parents should keep an eye on local pollen forecasts daily. When pollen levels are high or very high, limiting outdoor activities can help reduce exposure. Keeping windows closed, using air conditioning with filters, and showering after outdoor play can also help. During peak pollen times, avoiding outdoor chores like mowing or raking leaves is a good idea. Giving allergy medications as prescribed by a healthcare provider can prevent symptoms from worsening. Remember, each child is different, so working with a healthcare professional to develop a personalized plan is always best. In summary, pollen counts above 50 grains per cubic meter are often enough to cause symptoms in sensitive children, and counts above 100 are even more likely to trigger significant reactions. But because individual sensitivities vary, parents should watch their children closely and seek medical advice to keep allergy symptoms under control.